welcome. You're watching the Health Talk session by Yashoda Hospitals. Humidity and sweat make summers even more harder. But are you sweating a lot and feel something unusual about it? Is shaking hands with someone difficult because of this? Or is excessive sweating making you nervous in different situations? If yes, then you could be suffering from a condition which is known as hyperhidrosis. So let's discuss about excessive sweating or hyperhidrosis in our today's episode. I'm Dr. Lakshmi, and joining us today we have with us Dr. Manjunath, thoracic surgeon from Yashoda Hospitals, Secunderabad. Welcome to the program, doctor.
Hello, good morning. I'm Dr. Manjunath. I'm a thoracic surgeon at Yashoda Hospitals, Hyderabad, and I'm more than happy to talk about hyperhidrosis today.
Yeah, doctor. So what exactly is hyperhidrosis or excessive sweating? Because we all know that sweating is a normal physiological mechanism.
Basically, hyperhidrosis is a condition where, like normally we all sweat, okay? It's not like an abnormal phenomena. We all sweat under heat, under exercise, with some anxiety and all that stuff. Sometimes people don't have any inciting factor and still they sweat a lot. That is what is called as hyperhidrosis.
So how common is this condition, doctor, especially in our country?
See, the overall estimate is somewhere about 1 to 1.5% of population have hyperhidrosis. But the only problem is most of them neglect it and most of the disease goes unnoticed. So when you actually see the patients coming to hospitals because of this illness, some people are actually shy. Some people have social inhibitions to come up with this condition, so they don't come up to us with symptoms. Most of them are only the well-educated people are only coming to us with some symptoms like this.
So you've just mentioned that only well-educated people approach doctors with symptoms. So what are the symptoms for this condition?
The most common symptom is excessive sweating of the hands. It's like they will have dripping of the hands. Like everyone has sweatings, okay? But then these people have sweatings, and this will not be from one day or one event. It will be from childhood, from their early childhood and till their adolescence. We have had patients who are literally taking dry soakers to the exam halls because they are not able to hold the pen because they had so much sweating, and the whole paper gets wet. The exam paper gets wet. See, these are the main complaints with some people who come to us. They tell, and some people have so much of social inhibitions they stop going out to functions and parties because they feel, okay, shaking hands itself is a big problem with others because they sweat so much.
But doctor, as discussed earlier, that sweating is a normal phenomenon and most of us have this. So how do you differentiate between the normal sweating and this condition?
See, normally you sweat if the temperature is high inside the place where you stay, or if you're after a strong exercise. Or we have also seen excessive sweating in patients of thyroid disorders, in case of diabetes, in some infections, there is excessive sweating. If patient has high fever, they have sweating. Without anything, these patients have sweating. The sweating is on a daily basis, impairing their daily activities. So that is where, that's what we call hyperhidrosis, then that's where an intervention can be helpful for them.
So someone suffering with excessive sweating, when do you think they should consult a doctor, and more importantly, whom do you think they should consult?
Patients with excessive sweating, which is impairing their daily activities, which is hampering them from doing the regular stuff like shaking hands, writing a piece of paper without any stress, socializing easily, and staying without socks and gloves the whole day. That if patient is not able to do any of these, then I think they should consult us. Now, whom to consult is a big question because most of the patients with skin disease go to a dermatologist, which is fair enough because I think the dermatologists are the first contact for all these patients. But once they understand that it is not a local infection or a local disorder which is causing excessive sweating, and if they feel it's hyperhidrosis, I think they should come to a thoracic surgeon.
So doctor, what are the treatment options available for this condition? Is surgical option advisable?
There are multiple treatment options. If you go by the book, there are a lot of there are treatments like local iontophoresis. They actually do Botox also for nerves so that they this palms stop sweating. But the problem with all this is you need multiple settings. That is one thing, and the recurrence rates is very high. So what we have developed, what we have inculcated now into our curriculum is we do something called as a WATS sympathectomy, which is what we do is we identify the sympathetic trunk where all the nerve supply is there to these glands, to the sweaty palms and all that. Then we clip that branch so that the actual excess sweating reduces without any complications.
So how is this surgery better than what was done earlier, doctor? And what are the advantages that a patient can have with this?
So actually what we have developed is a technique popularized by Diego Gonzalez Rivas. So in this what we do is we do the clipping of the nerves. So if we remove the clip, it can be reversible. The whole procedure can be reversible. That's the first important thing. But if tomorrow if the patient comes back with some serious compensatory hyperhidrosis, we have a chance to reverse it. The most important thing is it's a daycare procedure. You don't need any intubation. You don't need any tubes after the surgery. The patient comes in the morning, gets operated, then goes back home in the evening, just with small 5 mm scars which are closed by a week or so. And patient actually can start working after 3-4 days to their hospital, to their home, to their workplace.
So I think it's wonderful because it's just one-time sitting. So when do you think a patient needs to come back again?
If a patient has sweating on both the sides of the arms and legs, we do a bilateral procedure, that's both the sides in the same setting. And again I want to reiterate that it's a daycare procedure. We don't place any tubes, we don't even intubate the patient. We just do it under local anesthesia and sedation. We clip the nerves and then we don't even place a chest tube. It's like so the patient can go home the same day, evening home, without any fuss. And he'll just have to come for one follow-up after a week or so, and that's it. After that there is no need to follow up also.
So doctor, since it's a surgical procedure, are there any complications associated with this?
The most common complication with which these patients come back is compensatory hyperhidrosis. For example, if a patient has sweaty palms, then they'll come back with sweaty axilla or the sweaty legs. This can happen, but this is a transient phenomena which stays about 1 to 1.5 months, and gradually over a period of time that also resolves, because it is just basically because the body is used to produce so much sweat that it tries to find alternative pathways to produce more sweat, and over a period of time the body adjusts to it, and then the whole sweating becomes nil.
So we've discussed about symptoms and the treatment options, but what happens if patients ignore and leave this condition untreated?
As such, it's not a life-threatening condition. Only thing is it will hamper your lifestyle, which is as good as yourself restricting to minimal work or minimal interaction with people. Many a times we see people coming up with saying that, okay, I'm not able to even shake hands in an office where people come to me, which is quite embarrassing. Okay, it's a normal phenomena. You shake hands, you talk to people. If you're not able to do that, you're not able to wear your right outfit because of your excessive sweating. And I think that is where you should consult us.
So before ending this episode, doctor, what message you would like to give to our audience out there regarding excessive sweating or hyperhidrosis condition?
The first and most important message is excessive sweating isn't normal. Many people say, okay, he is a little anxious, he always has this. They keep on, the parents keep telling the children, okay, this is normal, he used to have it from childhood. This is not normal, and then it's quite curable. So if you have a symptom, I think we can cure it. That's the message for today.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic excessive sweating or hyperhidrosis. Do join us for the next week as well. Until then, take care and stay healthy. Thank you.